Good morning. Today on Spotlight, an update on the strong impact COVID-19 is having on education, mental health, and our criminal justice system. That may be the bad news, but the good news is how nonprofit organizations and the philanthropic community have stepped up to try and fill the gap. Our guest, Dr. Holly Windram, Executive Director of the Michigan Education Corps, based in Grand Rapids, and Megan Slater, Program Director of the Hope Network and a clinical social worker in Macomb County. And later on our Sunday morning program, Miriam Nolan, President of the Community Foundation for Southeast Michigan, and Malenka Clark, President and CEO of the Hudson Weber Foundation. It's Sunday, September the 20th. I'm Chuck Stokes, and this is Spotlight. Dr. Windram, I'm going to begin with you. If there were problems with education and mental health, would it be fair to say that COVID-19 has increased that tenfold?
Yes, I would completely agree with that. We know that due to the COVID crisis, we are seeing even more learning loss that is taking place with students. So our most vulnerable students are struggling with that. And also the mental health issues that our kids are facing with the school closure, as well as just the pandemic, have also increased significantly.
Do you think that maybe society is almost underestimating the impact that COVID-19 may be having on our whole world of education because of the virtual learning, because of the social distancing, the things that we take normal when we send kids to school or have them right in our own kitchen or living room is not normal anymore, and that may have long-term consequences if we aren't careful?
I do. I think that we are starting to recognize that our kids are showing more signs and symptoms of just needing that relationship. So when kids were attending school in person, they had a relationship with their teachers, they had a relationship with each other. Well, with the COVID crisis, and especially with school closure and social distancing, they lose that. And that is just such a critical part of a child's development, both for education, but as well as the social emotional aspects.
Megan Slater, you're over program activities for the Hope Network, which stretches from east to west across this state. What impact has COVID-19 had on the programs that before COVID-19 you were doing every day without hardly thinking about it?
Well, we've definitely seen in recent months a significant increase in the number of people who are coming in and seeking services for the first time. And we are seeing an increase in individuals, in the needs of the individuals who have been a part of our services. A lot of increase in anxiety, a lot of increase in depression, just with so much uncertainty and so much kind of confusion around what's happening right now. Mm-hmm. So we're trying to help people work through that.
Sure. The Hope Network does a lot of different things, but in this new world that we're sort of operating in, where's your key concentration?
We're trying to help people recognize that there is no true expectation for this new normal right now. We're all trying to figure out what that is together, and we're trying to help normalize that it's okay to not know exactly what's going on. And to reach out and to seek help and to kind of learn how to come together, however that might look, whether it's, in a virtual capacity like this, to try to get the resources to help make the new normal make a little bit more sense.
Sure. You have a motto at the Hope Network, and it is helping people overcome. And I see that word all over your website. Explain the significance of that in terms of what you're trying to do every day. And that can go to either one of you or both of you.
Well, So that's our mission, is we want to help people overcome any barrier that's in their way from being able to lead a life of full quality, whether that's social, psychological, emotional, career. And so what Hope Network does is, while they do focus on the health aspect, they focus on physical and mental health, we also have a number of service lines that address what we call social determinants. And those are some of those external factors that can play a real role in our quality of life, like transportation, education, workforce development, so those kinds of things. So Hope Network really is kind of a one-stop shop for meeting the needs of the whole person.
We're going to take a little break here. We'll hurry right back, and I'll have some more questions for you. And I want to particularly drill down, Dr. Windram, on your organization, which is, you said it's not so much an affiliate of Hope Network as much as, what did you call it, a service?
A service line.
A service line. We'll find out what that means right after this. And welcome back to Spotlight. Dr. Windram, the Michigan Education Corps, what exactly is that?
Michigan Education Corps is one of 14 states. We are replicating the academic intervention programs using AmeriCorps members to deliver academic intervention services to age 3 to grade 8 students. So we have preschool reading corps, K-3 reading corps, and then math corps.
People can even kind of accelerate how they get their certification to be able to work with some of these students?
Yes, so we place individuals who are serving as AmeriCorps members to do direct service with kids. Now, with the onset of COVID, that has taken on a little bit of a different look. We do offer virtual as well as hybrid, so a combination of remote as well as in-person or in-person. And we work directly with the schools in order to determine the students that we work with. Now, if an individual is interested in being an interventionist, there are a lot of benefits. So they can qualify for an education award, but they can also earn a variety of credentials and even college credit. So there's a lot of benefits to both the workforce development aspect in addressing the teacher shortage, as well as helping to close the achievement gap for our kids.
Sure. Before I jump over to Megan, let's follow that line for just a second. I know I saw some rather alarming statistics in terms of the number of teachers that are leaving the teaching profession and the impact that COVID may be having on that. It was going on before COVID, if for no other reason, because we haven't been keeping up in a lot of areas and a lot of states with teacher salaries for the amount of stress and work that they have to do. But all of these other things have now come into that, and that's made it tough for the teaching profession, correct?
It has, and add on to that now, we're asking our teachers to adapt to a whole new method of teaching, as well as having to learn how to establish relationships with kids remotely, which is a whole nother kind of skill that many of our teachers, that's not what they were trained to do. They were trained to be in the classroom with the students in person. So everyone's having to adapt and shift. And our teachers, frankly, they're having to bear that burden in addition to all of the other requirements that they had to meet prior.
Yeah, we're asking an awful lot of the teaching profession. Megan Slater, you work with Hope Network, obviously, as the big umbrella, but your sort of area of concentration is there in Macomb County. Is that correct?
Yes. So we have a behavioral health clinic in Macomb County, offering outpatient services to adults and children.
Without going through a long clinical diagnosis, which is something that I'm sure you do on a professional level, for TV purposes here, if you could give people who are feeling what you just said and they need some help, what's the best advice you can give them?
The best advice that I can possibly give to individuals who feel like they are in need of help is that it is okay to reach out. Please do. Please contact your primary care professional, your mental health professional. Utilize the National Suicide Prevention Hotline if you're having thoughts of suicide. You can access services through Hope Network at hopenetwork.org. and you can help identify a behavioral health center that is near you. And you can begin to work with someone who can help start to make sense of a lot of the feelings that people are having.
Sure. The key thing here, Dr. Windram, is to not be embarrassed, to not have any sort of shame, but to make sure that you're reaching out, correct?
That's right. You know, I think all of us have to remember that this is not this COVID situation and these heightened feelings of change it is the new normal. One of the things that the words that our program is using regularly is we have to be flexible. And by flexible, it means that sometimes even with our kids, when our interventionists are meeting with them, sometimes we have to stop and take a pause from the academic intervention, and we have to do something like a mindful minute just to help them to get refocused or get their bodies ready to focus and engage. So for our parents, what we talk about with them as our tutors are getting involved with the intervention is create structure and have routine, but also be open to talking with your kids and recognizing when you need a break. And you need to step away from the computer, or you need to step away and maybe go outside for a little while just to get a mindful minute break.
I'm going to give you the very last question, Dr. Windram. Look ahead just a little bit. We've been operating with COVID since essentially March up until now. The cold weather hasn't hit. The weather is probably going to make this 10 times worse. You spent some time in cold country at the University of Minnesota. What advice you want to give people as we head into the not so nice weather?
You know, I'm going to go back to remain flexible. Flexibility is going to have to be our new normal. And I want to echo what Megan said about don't hesitate to reach out and ask for help. Everybody is going through a similar situation. And I think we tend to think that we have to kind of figure out how to manage it. And that's the same for our kids, our parents, and our educators, and all of us. And so really just wanting to make sure that people know that help is out there, and everyone might be at a different point in terms of when they need that help. So just accept that, try to embrace it and lean into it, and reach out, use your resources.
All right. Dr. Holly Windram and Megan Slater, thank you so much for joining us today on Spotlight. We should emphasize that Hope Network reaches all the way across this state. So if you're watching us here in the Metro Detroit area, if you're watching us in the Lansing area, or even over in West Michigan, you can always access the Hope Network. Thank you so much for joining us today on Spotlight, and stay safe.
Thank you.
Thank you. And when Spotlight returns, joining us will be Miriam Nolan of the Community Foundation for Southeast Michigan and Malenka Clark of the Hudson Weber Foundation. We'll be right back. Welcome back to Spotlight. Joining me now is Miriam Nolan. She is president of the Community Foundation for Southeast Michigan, and Malenka Clark. She is president and CEO of the Hudson Weber Foundation. Thank you for joining me today on Spotlight, ladies.
Thank you.
Miriam, I'm going to start with you. You've been here, I don't know, too many times for either one of us to count, and then we would start dating ourselves in terms of age. But the last time you were here was, I think, in March, right at the onset of COVID-19. Bring us up to date on what the philanthropic community has been doing and the impact that you've been delivering.
Glad to be here. Yes, the philanthropic community has come together, which is really important, because in a time like the pandemic, the more we can work together, the better. We, in fact, with the help of Hudson Weber and others, have distributed almost $20 million. We moved from testing and the early crisis into now the more long-term impacts of COVID. We did do $200,000 of grants for immigrants and refugees. We're working on other hard-to-reach prisoners, homeless individuals, and then we just made grants this week, another large round, to work on mental health issues, domestic violence, some of the going to school issues that are very real. And then we're going to look at the longer term impact. Unfortunately, the pandemic is with us for a while more.
All right, you aren't running out of money over there, are you?
We always need more money. Thank you.
And if you were, you wouldn't tell me. Okay. Malenka Clark, you've partnered with the Community Foundation for Southeast Michigan. How did this partnership come about?
Sure. Well, I should start by saying the two foundations have a very long history together and in fact even share some trustees. But we have been working at Hudson Weber, we've been working on really thinking about connecting people to opportunity. And on the flip side of that, addressing structural barriers to opportunity, which includes involvement with the criminal justice system. And we've been very fortunate that as we've leaned into that work, we found a few other committed funders that wanted to come to the table, including the Community Foundation, who is also serving as the fiduciary for the fund. So we're really glad about the partnership.
And you have this Justice Fund. What exactly is that?
Sure. So the best way to think, we've been working on it for some time, but in light of the national conversation, I think many funders, in philanthropy are thinking about ways in which to fund differently. Think about, what are we funding and how are we funding? And I think this fund is responsive in a couple of ways. So first, I talked about structural barriers to opportunity. What's important to know is that, a lot of the conversation has been focused on police brutality, but the justice system writ large is really having a profound impact on communities in our state. The incarceration rate is quite high. You should know nationally, we've got about 4 or 5% of the population in the world, but 25% of the prison population. So we are relying on incarceration to address issues, and Miriam mentioned the mental health issue, but interventions that might be, we might see better results with more innovative interventions that lead to better outcomes than just putting people in jail. And when you add to that the racial disparities in the system, the disparate impact on communities of color.
Give us some numbers that
Sure.
I'm sure are in the top of your head so that people get an accurate picture of what we're doing in terms of incarceration with this state and how that may potentially impact African Americans more than other groups.
So we've got about 40,000 individuals incarcerated in our state and about another 100,000 that are under supervision. African Americans are 3 times more likely to be incarcerated than whites. I think we're about 14% of the population, 50% of the prison population, and 65% of folks that are serving long sentences. And when you think about, there are a number of studies that show even when controlling for this same offense that Blacks are more likely to be stopped by the police, more likely to be charged with an offense when stopped, and that those charges are more likely to be more serious. And then when they're sentenced, they're more likely than whites to get longer sentences for their crimes. So the disparities are across the system.
Sure. Okay, we need to take a quick break. When we come back, Miriam, I want to pick up on you to talk about the partnership from your vantage point and why this is a key part of that giving that you and your organization do in terms of philanthropic services. We'll be right back. Stay with us. Miriam Nolan, no one likes taxes. And so I would imagine because we aren't spending in terms of taxes what we were spending 30 some odd years ago in this state, more of that is falling on the philanthropic community. Is it almost too much pressure and too much to ask of you and your organizations that you're partnered with to be able to try to make a dent in these things that we need to make a dent in our society?
I don't think the philanthropic sector can supplant the public dollars that aren't there. It's just too large. So what the philanthropic sector can do is take on issues where we think we can make a difference. It may leverage the dollars in the right direction. In this case, as Malenka said, there is a disproportionate amount of money right now needing to be spent on incarceration, I suppose, or at least being spent, even in relation to the percentage that's being spent on education. What we're doing with the Justice Fund, really with the leadership of the Hudson Weber Foundation, is helping bring the organizations together Make the grants. About $500,000 in grants have already been made to 26 organizations on the front line of prison reform and justice reform in this state. That's the kind of work that the philanthropic sector can do. And it's really important in this case that the real leadership in terms of thought leadership and the knowledge to bring this forward is coming from the Hudson Weber Foundation. We can really do the make the grants and facilitate this process. But we're fortunate in times like this to partner up because taxes aren't there to do the work that we need to have done.
Sure. Malenka, I know that you have the Hudson Weber Foundation, but there's also a few other foundations up under that that have helped you get the money that you need to be able to help spread around. And who are some of the organizations that this money is being given to?
Yeah, and no, it's a true partnership. So of course, the Community Foundation, the Ford Foundation, the Flynn Foundation, the Public Welfare Foundation, and the Kellogg Foundation are all at the table with us as we invest in this work. And I would say also, we've been able to do some COVID response grants, and those were also supported by a national fund called the Justice Mobility Fund.
How will you measure success of this partnership and this particular program?
That's a wonderful question. So I would say a couple of things. We are, you talked a little bit about the philanthropic funding and the public sector and how philanthropy can't fill that gap. So we're really looking for policy reform where we can move public dollars, where we can innovate and support pilots and also advocacy so that we can see, with respect to the public sector, policies that really lean into alternatives to incarceration, different types of interventions that can get us good outcomes.
Miriam, same question.
I would say that we also want to have the general public aware of what is actually happening, the kind of data that you had Malenka talk about in the beginning, because that's what will really change behavior. And it will begin to say to the state, what's the best place for our money for the long term? How do we really educate our people in a way that they don't end up incarcerated, for example? So I would judge it in addition to what Malenka said. You can judge the policy change, and that happens because public awareness changes.
And if people believe in what your organizations are doing, they can always go to your website, get more information, and certainly, as you mentioned earlier, Miriam, there's never too much money to be able to give, correct?
Absolutely. We're always eager to have others call us, call Hudson Weber, and we'll put the money to good use. All
right, very good. Miriam Nolan, Malenka Clark, thank you so much for joining us today on Spotlight. Good luck to both of you and what you're trying to do. And I'm Chuck Stokes. We'll be back next week with more newsmakers in the Spotlight. We hope you have a great week.